Hello everyone, my name's Peter Walsh. Thank you very much for joining us on the Snack and Learn webinar today. We're going to be talking about a health impact assessment of a sustainable master plan, and this is for a new town development. As I said, I'm Dr. Peter Walsh. I'm an air quality and health impact specialist at WSP UK.
Hi, my name's Claire Beard and I'm a principal consultant specialising in health impact assessments within our environmental assessment and management team at WSP in the UK.
So both Claire and I are going to present this health impact assessment. We undertook the initial work and just two housekeeping items that I just need to cover before we progress. And the first is that this presentation is currently available in the handout as part of your webinar app. Your webinar profile will have that. So you can find that in the chat box, or sorry, in the handout box. And that there will be time for questions at the end of this presentation. Okay, right, shall progress with the webinar. So just some background to the project. The focus of this presentation today is upon a site which is located in Waterbeach, and that's in the city of Cambridge. And for those of you who aren't necessarily familiar with Cambridge, Cambridge is a city, small to medium-sized city, which is approximately 70 miles north of London. And Waterbeach is currently quite a small town, satellite town, to the north of Cambridge, and the master plan was centred around the expansion of Waterbeach to become effectively a sustainable town in itself. So in terms of the project and the Waterbeach site, the master plan site, the site had been allocated up to 10,000 homes, as well as community facilities, and that was under the principle that it would present itself as a new town, and the old town of several thousand properties would actually expand into a much larger conglomerate, and the idea was to try and develop that almost as an entire sustainable development. WSP in this instance were appointed to provide transport planning advice in 2013 for the Waterbeach Newtown East. The development was cut into two, and there was a Waterbeach New Development West and a separate Waterbeach Development Newtown East, and we were providing transport advice for the component to the east. And within that east presentation, development was housing for 4,500 homes, which is eastern town, two primary schools with some early years provision, a secondary school, a significant amount of employment space, 22,000 square meters, and 5,000 square meters of retail space. There was also public open space as well as play and pitches. There was a separate full planning application for the reallocation of the station, which was moving from the current existing Waterbeach town, but into the heart of the new town. And a health impact assessment was required by the planning authority through a planning policy. So the key challenges within this were that there was already rapid employment growth within Cambridge, as I mentioned before, that's to the south, and because of that there was therefore a housing shortfall in the region. And this led to insufficiently employed residents living locally, so there was long commutes occurring, not just into Cambridge, but within the satellite businesses surrounding Cambridge, in commuting by from over several hours. And this also put pressure on the transport network, particularly on the road feeding into Cambridge, the A10, which was at capacity. There was no further capacity for additional trips to occur along the A10. And also this then led to a car-dominant travel system because people were commuting in via rural areas, and which weren't adequately serviced by public transport. And there was a limitation of really the existing rail station at Waterbeach. So the rail station itself was relatively small. It was to the south. It was relatively difficult to get to, and services were relatively infrequent as well. So the vision for the new town to overcome these issues was that sustainable travel was and accessibility were key. The new town it should be delivering new housing with key facilities. It would deliver and provide shops, schools, and jobs should be within walking distance. And trips were meant to be kept locally. The reason why is that Waterbeach New Town itself was going to be permitted, would be permitted planning application on the basis that there would be virtually no additional trips onto the A10. And remember, that's the feeder road that goes into Cambridge because it was at capacity. So the principle was to try and generate a new town which was sustainable in terms of its own transport system, that it would have a sufficient critical mass of residents, jobs, schools, leisure facilities, employment that would internalise trips. And in order to, or if those trips were to occur, they'd occur by sustainable means, such as public transport or active travel. And part of that was moving the railway station from, as I mentioned before, from the south into that heart of that town. And the idea was, the principle behind this really was that we should be putting people first, and that Waterbeach should really be a great place to live. The science, the data behind the internalisation of trips came from a number of towns and cities, looking at the commuting internalisation. So the internalisation of trips is the criteria on the left-hand side, and on the x-axis it's the density or the population within those towns. And the current population of Waterbeach was in the region of 4,000 to 4,000. Internalisation of trips were very low, around about 10%. And as we increased the size of Waterbeach, combining the Waterbeach East and the Waterbeach East and the Waterbeach West development, we were moving closer to 40% of internalisation of trips. So increasing that population within a high population density actually internalised trips. So Waterbeach East internal trips were around about 20%. Waterbeach West would have been 30%. A combined new town would have given us close to 50% of internal trips, which is considerable. The development and it's the health impact assessment upon this development, we feel achieved and aligned with a number of UN Sustainable Development Goals. One of them was the goal of good health and well-being. Another was the goal of sustainable cities and communities. And the third was the goal of climate action. So these are the goals we feel that have been achieved. So Claire Beard is now going to talk to you about how we undertook the health impact assessment of what we consider to be a sustainable development. Okay, Claire.
Right, thank you, Peter. So health impact assessments are not a new tool, but they are becoming more prevalent in UK planning policy as the links between human health and spatial planning are becoming more widely understood. The assessment process for health impact assessments, also known as HIAs, looks at how a plan or a project might impact on social determinants of health and well-being. determinants of health are made up of a range of factors shown in this diagram, and they can include things such as housing conditions, types of employment people might have, or levels of access to services, services such as healthcare, education, training, as well as access to transport links and green and open spaces. The project was assessed against the determinants that are listed on the slide, and this was to identify where impacts on health outcomes might arise, both positively and negatively. Undertaking the HIA and looking at each of these determinants in turn ensured that health impacts were a key consideration for the project. This process of looking at the potential impacts of each of these determinants resulted in WSP being able to influence the master plan design and place health and well-being really at the center of the design. So research in 1981 showed that people living, excuse me,
There's some research I'm going to pick up from here, and Claire will come back. There was some research from the 90s that showed that people living on streets with the lightest traffic had some benefits from that, indirect benefits from that. And one of those was that they were likely to have twice as many acquaintances and 3 times as many friends as those people who lived on similar streets but with heaviest traffic. Also, the people living on streets with lightest traffic were more likely to know and trust their neighbours than people who lived in car-dependent localities. And people living on streets with lightest traffic were also more likely to have used public space and local services, thereby improving social capital. So in terms of the design, we were looking at Claire's back, so I'm going to hand back over to you, Claire.
Apologies. So the design took on this approach of moving cars to the periphery of the development and creating steads. And this really made the development centered on people and their needs and had a number of associated benefits, such as providing really local services that are easily acceptable and creating social meeting points for residents. Parking is still provided within the development, and it's provided in a secure way, but it's located away from pedestrians. It's also just as easy to access public transport as it would be to access, say, your car if it was parked away from the development. Active travel is built into the design, and it's really made an easy choice for people to choose. It's kind of just as easy to maybe hop on a bus as it is to maybe go to your car or walk to your local service, your school, wherever. But it's really built into how the development was designed. And limited vehicle access within the steads ensured that pedestrians really remain the priority in the environment. Any vehicles that did come into the development would be at a very low speed, and pedestrians would be kind of the priority throughout. So Waterbeach was one of the UK's first master plan developments, which really placed health objectives as central to the project's values and design. By removing cars and encouraging local journeys to be made by foot or bike, and create open social spaces for recreation and community interaction, really kind of led to this unique approach to design. It encouraged and enabled active travel through the design with measures such as setting equal distances to reach car parking and bus stops. And with such a large residential development, services and facilities were included or planned to be included in the phasing of development. So rather than building all the residential properties first and moving maybe schools and other facilities at the end of the development, these community spaces and community facilities were built into the phasing of the project. So I hope that gives a very brief and succinct overview of the project and where our health assessment really kind of played a part in influencing the design and making it a very people-centered project.
Thank you, Claire and Peter, for a great presentation. So before moving into the Q&A session, just to let you know that you can log questions in the question box on the GoToWebinar platform, and also the presentation is available as a PDF to download from the handouts box. So we start with the first question. Why would a health impact assessment be required at all?
So Claire, do you want to take that, or shall I?
Claire, you're muted, sorry.
One of the main reasons a health impact assessment might be required is through policy. So a local council might require it as part of a planning submission when you're making a planning application. It might be something that would be required to be submitted alongside other planning documents. It's certainly becoming more prevalent within planning policy as something to help decision makers. You know, it's essentially a decision-making tool. It should provide information so that someone who's making a decision about a planning or a policy, they can use that information to make their decision. But I mean, there's other reasons it can be kind of used to, I don't know, inform policy as well. There's a variety of different, I mean, HIA can be done on a plan or a policy or a project. It doesn't necessarily have to be just a development project. It could be done on a new policy that's being implemented as well. So there's a range of reasons. Did you have anything to add, Peter?
Yes, I mean, in terms of the larger the scheme, more likely a HIA will be required, and within SAs or SEAs, sustainable environmental assessments, often health needs to be assessed, and health impact assessments, certainly in the UK and Europe, have been used as tools to assess those impacts of those schemes. And more local authorities and planning authorities are beginning to adopt health impact assessment policies that are specific to either key areas, so areas where they want to draw attention, or just at major scheme level, or major development level.
Thank you.
Okay.
The next question is, do you have tools for the HIA that can be shared?
It's a good question. So yes, we can share. We can share methods. There is no distinct approach in the UK for undertaking a health impact assessment. There are broad approaches to undertake a health impact assessment, from screening through to rapid participatory through to full-blown HIA, where you actually go out and you collect your own health data, which really that's more sort of regional government or government level. But within that, the most common form of health impact assessment is what we would term a rapid participatory assessment, and there have been some guidance documents or some approaches to undertake those. Certainly, Australia have published a number of those. And I'm trying to think of any other countries that have published them. In the UK, the Walsh government have outlined how they would like a health impact assessment to look, but they've not been overly prescriptive. And the reason why it's been a little bit difficult to produce any distinct tools is because health impact assessments can be undertaken on a government policy or a regional or local authority policy through to a large development scheme, such as a leisure centre or a stadium. So those are very, very different things to look at. So that's why it's not overly prescriptive. Have you got anything else, Claire, that you want to?
Yeah, I think you can produce. There's no one way a HIA can be written. You can have very small ones. I think the key thing to remember is they should be done proportionate to what you're likely impacts are going to be. So, you know, it will depend on the size, the scale, the complexity of what you're assessing, and then what that HIA would look like. You know, how many different determinants might be impacted by a policy or a plan or a project, and that will then influence what the end HIA looks like and the form. So there'll be varying scales and sizes to them, really.
Yes, and actually you've just touched on the point there that the type and the approach that a health impact assessment can take is really just is down to the data that is available. In the UK, we're very fortunate. We have a lot of health data, with lots of regional spatial data, so we can undertake quite detailed assessments very rapidly. But in some instances, that isn't always the case. Okay.
Thank you. Can you describe the steps taken to conduct the HIA?
Good question. Very good question. Sorry, I should also.
We have many. Sorry, we have a lot of questions coming through.
I should apologise for not having a camera on. My camera is faulty at the moment. Yes, right. Let me just recall. Yeah, so my first step would be screening. Is it needed? And there's all sorts of questions around, would HIA be needed? Would it be beneficial? Claire, would you then say what scoping would be the next? So how much are we going to assess of that? And what are we going to include? And therefore, you'll be talking to the promoter of the scheme or the proponent of the scheme, whether that's a developer or a local authority. And then you'll also be talking to some of your regulators, your planning regulators. Claire, what would you say the next stage would be in your?
Well, sometimes during the scoping stage, depending on the size and scale of your scheme, you might set up a steering group to kind of inform your scope and inform your kind of data collection as well.
Yes, yeah, good point. See, the steering group, which is unusual in an assessment, very few assessments have a steering group, but because of going back to the second question, what's the method and tools for a HIA, because they're not clear cut, a steering group effectively governs the health impact assessment, and so that steering group would have key responsibility in terms of making sure that the health impact assessment was robust and wasn't just a tick box exercise. So yes, a steering group would really oversee. They wouldn't become involved in the health impact assessment, but they would set out a terms of reference effectively, and they would represent effectively the population really who are going potentially to be impacted by the scheme. Then from the steering group, from the scoping, it will be data collection and baselining. Working out, Claire's mentioned things called determinants of health. So how people are going to be affected, what elements of the plan are going to affect either their health directly for air quality, noise, water contamination, how it's going to affect them indirectly through employment, education, access to services such as health and transport, and those would be determinants of health. That will be decided at scoping and baselining stage, and then assessment, and going ahead with the assessment once you know what your population is. And from assessment, then the key, as an outcome of assessment, the key crux, the output of the development of the assessment is, Claire, I'll let you finish that one in terms of recommendations.
So your final outcomes are going to be evidence-based, robust recommendations that you're making as a result of your assessment for the design. Sometimes these can involve what we like to call tricky conversations, that your assessment's kind of putting something up that might result in design changes or things that maybe a developer or whoever doesn't really want to include, but this is part of the process of coming up with recommendations for making a project or a plan have beneficial impacts on health outcomes as a result.
So to go back to the Waterbeach example, so though the master plan was sustainable, and was achieving some great aims, there were still recommendations that we put forward, and a lot of those were around active travel that linked the steads and the residences to nodes of public transport, so such as the Waterbeach new station. So that we were pushing for a greater level of, firstly, a level of pedestrian access to the station and a lower priority of car access to the station. Greater coverage of bicycle secure facilities, so people are able to cycle and be confident that they'll be able to secure their bicycle or their scooter to some security at the station. And we suggested and requested a reconfiguration of road layout be undertaken to ensure that pedestrians and cyclists were given primary priority, and that the assumption was always that the car was secondary to that. And we felt that was important because of the nature of those steads, where you had a lot of free play and free movement within the individual steads. What we didn't want to do is for cyclists and pedestrians and even children to suddenly be confronted with a car-dominated road network throughout the development. We wanted it to be gradual, or for them to continue that prioritization of active travel. So those are recommendations we put forward. Also recommendations around phasing, as found in other new towns locally, that the development of residential development over local facilities development led to effectively sterile towns, and by decanting people, particularly young families, where people were often spending large amounts of time at home on their own, decanting them into residences where there were no external facilities. There was no primary school, there was no local shop, there was no local park. Was found to be detrimental to health, and there was anecdotes of increased suicide attempts in one of those towns. That wasn't evidenced by any data, but it was anecdotal. It's another thing that HIs can look at, is anecdotal evidence. So we really prioritised the integration of community facilities into the development as it progressed.
Thank you. The next question is combined of three, so bear with me. What organizations or community groups did you include for consultation? How was the engagement and consultation turned out? And any lessons learned?
Again, good question. The development itself had already worked with community groups, so the existing Waterbeach community, and we worked with the local authority because the local authority had a very specific set of guidelines for their health impact assessment. We didn't appoint a steering group in this instance because it was the governance effectively of the health impact assessment had been taken care of by the local planning officer. We contacted, I'm trying to think, certainly local government. There was no actual existing community into the new town itself, so that was quite difficult to so outside of the existing Waterbeach town, there was no local residents, and what we tried to do was to be strategic and use some of the consultations that were put forward by local residents and local community two local community groups by our transport colleagues. Claire, have you got anything to add there? I'm trying to recall actually those components of it.
Yeah, I think one thing to note is that the site itself was former army barracks, so there wasn't anyone on the site at the time. However, some of our baseline information was informed by the previous population who who would have been living within the army barracks. So that was a bit of a limitation, I suppose, in some of our baseline data gathering that we had, because it wasn't necessarily representative of the community that was remained in the area once the barracks were closed down. But yeah, there was a fair amount of consultation, as Peter says, as part of some of the traffic work, because that was a real concern of the existing community, was with the movement of the rail station from close to the existing population to closer to the new population. There were quite a few concerns around access to that rail station, and people, you know, having a rail station on their doorstep to suddenly having to travel a little bit further to reach it. That was something that had to be addressed, that came up through consultation and was quite an important issue. But no, nothing further.
Thank you. We'll take the last question. We don't have a lot of time. What health benefits are you measuring, and how are they being measured?
Well, I think this is something that comes out of the HIA process at the end, is the very last stage of a HIA is monitoring, and that's monitoring whether the recommendations that you have put forth have, I suppose, made a difference and had an output. But I'd say this is also an area that's not very well done. It kind of, the responsibility isn't clear on who's making those measurements sometimes, and how they would change. So in terms of the kind of impacts, I mean, the development only received planning permission back in the end of January, so it hasn't started yet. But I imagine there will be some measurements by the local government on how it is, you know, planning conditions associated with the development will come about, and those will be monitored. And my guess is they will have links to some of the recommendations that we provided in the HIA.
So in terms of outcomes that would link, or our view of positive outcomes that would link to this development, would be low ambient noise from low vehicle use or lower vehicle use. Air quality would have improved from the existing Waterbeach town into the new town. We'd expect there to be lower vehicle emissions, and lower instances of people being exposed to poor air quality, as some of those steads allow. People are mingling and meeting and playing and socializing and traveling through each stead away from road vehicles, away from being close to vehicle emissions from road vehicles. There'll be a higher incidence of active travel in the way in which, whatever way in which that is, or activity, I should say, whatever way that is measured. There are a number of matrices that would be measured. Potentially a higher uptake and use of public transport. There's also a guided bus, a Cambridge guided bus system, which is a former light railway, a form of light transport system that's going to be introduced into the town at some point. So the opportunities for public transport are huge in this particular town, and there are some indirect measurements that can be undertaken. There's a national wellbeing survey, which is undertaken every few years, asking questions around people's well-being, and be interesting to see for the area surrounding Waterbeach what that comes out with, whether people feel that they're a great improved well-being in relation to the existing town to the south.
Thank you. Thank you for a fantastic presentation. We have additional questions which will be answered directly by the presenters. Apology that we don't have time to cover all the questions today. So thank you very much for your time. Thank you, Claire and Peter, for a fantastic presentation. And I will wrap up the webinar now. Thank you very much, everyone.
Thank you.
Thank you. Thank you for the opportunity. Bye-bye.
Thank you. Bye.